So good morning everybody. Respected senior veterinarians, fellow veterinarians, friends, a warm good morning everybody. So at the outset I would like to thank the organizing committee of LAVA-TN 8th CVE for providing me this great opportunity to be with you, and I am very happy to be with you since I was in the animal husbandry department for almost 5 years, and definitely I know the practical difficulties. So my presentation will be mostly, it will be practical oriented, and at any point of time you can stop me and you can have your doubts clarified. So let me start with the disclosure statement. I have no conflict of interest. Whatever the drugs, whatever I'm showing, I have no conflict of interest. So there is a changing ethical and moral concerns towards animal. Definitely as veterinarian, it is our bound duty to change our attitude to provide superior veterinary care. So the demand is changing. It is not like 25 years back. So there is a change in the moral as well as ethical perspective of clients, public, animal welfare activists, officers, definitely. From layman to director of veterinary services, there is a change in perspective. So it is our bound duty to accommodate this and change our practice to provide pain-free, superior veterinary care. Wherever possible, it should be superior. So let me start with a small case. So a 4-year-old cattle was presented. It was not even recently calved. So they were saying that it was anorectic. That's all. The history is anorectic. Whatever case comes, they will say it is anorectic. And he was saying that it is moving its tongue. So they were thinking and they were treating it for almost for 4-5 days for suspecting ketosis. So when we did a clinical examination, there was a rubber band causing strangulation on the tongue. So this is an unforeseen. It is not an expected, it is not an usual case. But still, you have to expect the unexpected cases. So this can be a malicious or it can be an accidental. When it is garbaging, probably it would have entered, it would have caught into the tongue, probably it would have caused the problem. It could be probably a malicious. So it is our bound duty to do a thorough clinical examination. A simple clinical examination will give you a clue, will give you a confirmative diagnosis, and definitely you can rectify it. And it has recovered uneventfully. So the carry home message is thorough clinical examination is vital. Communicate with the animal. As Raman sir was insisting every day, try to do a physical touch, try to do a thorough clinical examination. Thorough clinical examination cannot be replaced by whatever gadgets that is available, modern gadgets. So importance of surgical intervention, coming on to the topic. So as a surgeon, I recommend try to do surgical interventions. So this will differentiate a qualified veterinarian from a unqualified person. That's all. Only when you have that courage to touch the BP blade, you will be treated in a different way by the clients. Nothing will happen. You can even cut the jugular vein, nothing will happen. You can definitely, you can ligate, and definitely collateral circulation can be re-established. Remember that. When you can cut a jugular vein and when you can re-establish collateral circulation, you are not going to do more than that. That's all. Very simple. So always try to go for some surgical intervention. So consider a case is presented. Life-threatening ruminal tympani. Go for a clinical examination. If it is a choke, sedate the animal. Do a chemical restraint. Don't always depend on physical restraint. So the days are gone. How many of you still use Nokia 3315? None of you. Even Prithviraj sir has changed to Android iPhone. So when he can change to iPhone, still why we are supposed to go with physical restraint? Go with chemical restraint. Do comfortably. Everyone wants to do a white collar job. And you want to do. Yes, you can do. But do it in a methodical way, scientific way. You don't want to cast the animal, you don't want to tie the legs. That means go for chemical restraint. That's all. When you restrain an animal with a chemical, with an anesthetic agent, definitely the intervention is going to be more aesthetic, more effective, going to have successful outcome. Consider you are presented with an life-threatening flail chest. You are not going to do high-tech techniques. You are going to sedate the animal, you are going to do a small preparation, and you are going to suture. Definitely, you don't need to learn all suturing technique. Simple interrupted, if you can do, yes, that is more than enough. If you can do simple continuous, it is best, that's all. So, a simple surgical intervention in a field condition definitely will save the animal. If you are referring sometimes flail chest during transport, if it is moving and if it is going to cause further trauma, animal can collapse at any point of time. So definitely this can be, this is a simple procedure, sedate it, do a suturing, that's all. So you can say that you do not have any suture material. So in the subsequent slide, I will make you confident that with whatever material available you can do. Abscess lancing, very simple technique. Make a liberal incision, drain out the contents. You don't require anything. You need just a shaving blade. With the shaving blade, you can definitely do a lancing. So you don't require high-tech equipment. Do a lancing, treat it appropriately. Definitely you will have successful outcome. So the carry-home message is timely. It should be timely. Decide the time and do a exact intervention, what is required. Definitely that will result in successful outcome. So coming on to the part 1. Basics are always vital. Most of the time we miss this basics. So when you want to do a surgical intervention, when you want to touch BP blade from tomorrow, you need to know only two things. One is gentle handling of tissue, the second one is aseptic surgery. The asepsis is the most neglected part. Aseptic surgery is the fundamental concept. It is a medical concept. So we need to understand why. It need not be a surgical intervention. Let it be anything, any medical intervention, veterinary intervention, medical related. So you need to have a basic aseptic concept so that your technique is going to be more aesthetic. The client will appreciate, the client will like. There should be no blood tinge on the animal after you discharge the animal. After, when you are sending out from the dispensary, it should not have blood stain. So this is the very basic concept. So do a gentle handling, concentrate on aseptic practice. So definitely it is going to improve the surgical outcome. So we consider sepsis as an insult, degrading thing for a surgeon. If you want to do a intervention, you are supposed to avoid this sepsis. Very simple. You have to isolate the area to be operated from the surrounding tissue. Only thing is, you are going to put a cloth over the surgical site and you are going to separate it. So it is available. If you do not have a surgical drape, purchase a polythene drape, 30 rupees, 40 rupees. Even if it is not available, purchase a மிக்சர் கடையில் நல்ல பேக்கரியில் ஒரு 10 கிலோ மிக்சரை கொட்டி வச்சுருக்கிற கவரை வாங்க, fold it, 4 கார்னர், ஒரு கட்டு, put it inside. So impervious. Your intervention will be more aesthetic. You will not be contaminating the suture. சூச்சரை மண்ணிலேயே விட்டு சூச்சரை போட்டிங்கன்னா definitely it is going to carry the infection from the environment into the tissue. You are going to end up with complication. Post-operative complication can be avoided by simply doing a draping. இதுக்கு drape எல்லாம் கிடைக்கவே இல்லை அப்படின்னா I am from விழுப்புரம். ஸோ எப்பெல்லாம் கன்னிகா பரமேஸ்வரி ஸ்டோருக்கு போகிறனோ கீழே போவேன், இந்த பீஸ் பேண்ட் பிட்டை வெட்டிட்டு 1/4 மீட்டரு 35 சென்டிமீட்டர்னு கிடக்கிறத 10 ரூபா 20 ரூபான்னு ஸ்டிக்கர் ஒட்டியிருப்பான். 10 இருக்கும், 10 தூக்கிட்டு வந்துட்டோன்னா யூஸ் அண்ட் த்ரோ 10 ரூபா தான். ஸோ யூ வில் ஹாவ் க்ளீன் டெக்னிக் will be clean, so you will have successful outcome. And wound has to be cleaned. Remember, there is a difference in the wound management between a human patient and veterinary patient. All patient will be presented with wound that will have a gross contamination, and we also have a wrong concept that applying a water and washing will cause sepsis. அதில் மண் சாணி எல்லாம் இருக்கும். அதெல்லாம் காஸ் பண்ணாத செப்சிஸை நாம் தண்ணியை போட்டு கழுவுனா வந்துடும் அப்படின்னு ஓனரும் நினச்சிட்டு இருப்பாங்க, நாமளும் நினச்சிட்டு இருப்போம். ரிமூவ் தட் கான்செப்ட். யூஸ் டேப் வாட்டர். Use tap water. Wherever you encounter wound, thoroughly wash it with soap. It can be anything, but preferably Medimix வந்து it is in the biological pH அந்த ரேஞ்சில் இருக்கிறதுனால I have put Medimix. So if you do not have Medimix, whatever soap is available, try to use that and thoroughly clean the wound first. Remove the gross contamination. And if you want, you can have a sprayer filled with povidone. You can add povidone when you are applying soap. Definitely you will remove gross contamination completely. If it is going to involve a delicate tissue such as a wound around eye, use Johnson's baby shampoo. So it is not going to cause irritation. Definitely you can achieve cleaning. When you want to do a intervention, you need to prepare the surgical site. So you need to do a shaving. You may not have time. So try to have a razor. Attach a blade, remove the upper part, put it, and immediately you can do quick preparation. This will be time saving. With the blade, sometimes you have to do it very slowly. So have a razor, do it like this. So immediately you can prepare a large area. So this is a very simple technique where you can have a effective preparation of surgical site. And gentle handling. Always use appropriate sized syringes and needles. If you want to do a ocular intervention, try to go for 24 or 25 gauge. Don't go with 18 gauge needle. 18 gauge animal will be definitely opposing. Definitely it will be moving. If it is moving, your intervention is not going to be effective. So selecting the appropriate needle. 24 gauge is available. You have 18 gauge. Select 24 gauge for local infiltration involving delicate tissues. And if you want to do an abscess lancing, be gentle. Restrain the animal properly. It can be a physical or chemical. And there is no hard and fast rule that you are supposed to use only 22 BP blade. I am using number 15 blade. 15 blade is meant for ophthalmic intervention. When you can do it for a abscess lancing in a animal, it is moving. Because it is very gentle, 15 blade will cause minimal trauma. Animal will be comfortable. It is allowing, and I am making a very large incision. Make a large incision to allow complete drainage of purulent material. Don't make very small incision. Make a liberal incision so that you can do intervention, you can do dressing, you can pack the cavity, because most of the time we are not going to do all the time. We are going to advise the owner. So it should be convenient for the owner also. So he should understand and he should do it. So make a liberal incision. And coming on to the gentle handling. So almost 10-15 years back, we were using all these eyed needles. Now, almost all companies are supplying swatched on needle, and it is available in all e-commerce platform, Amazon, Flipkart, the moment you place an order, next day you are going to have the material in your hand ready-made. But you need to have a plan. Tomorrow, if you want to do a surgery, you have to have a checklist checked the day before, not after going into the patient home and checking. So try to have everything ready the day before the day of surgery. So try to use swatched on needle. The advantage is, whatever be the condition, whatever be the working atmosphere, when you have a swatched on needle, your intervention will be very easy, because you need not put effort to take a bite. Swatched on needle will be use and throw. It will be sharp. Now almost all companies, they are supplying with reverse cutting, everything. So select the suture size, select the suture needle type. That's all. Finished. Very quickly you can do surgical intervention. Coming on to the suture. So most of the young generation, they will be preferring PGA. They never know about catgut. That too plain catgut, no, because the supply has been discontinued. Maybe chromic catgut, the non-boilable, yes, boilable probably 25 years back, 30 years back, maybe Prithviraj sir and seniors may be knowing. Dispensary had that supply, but now it is outdated. And those who have practiced surgery with catgut, remember, if you are convenient with number 1 catgut, you have to select number 2 PGA. The reason is the nomenclature, the size for synthetic and catgut is totally different. So 2 generation veterinarians are there. One will be knowing only about PGA, polyglactin, Vicryl. One set of people would have been using only catgut, and they will be selecting based on their experience. And when they want to switch over, the size selection should be different. So remember, if you are convenient with 1 catgut, you have to select 2 in the synthetic. So this correlation you have to remember. And catgut, the most common mistake is hernia. Everybody will operate, but they will say that it has failed or recurrence. And when you ask, they will say that they have used catgut for hernial ring closure. Catgut should not be used, that's all. Whatever be the size, number 2, number 3, number 5, no. Catgut has unpredictable rate of absorption. It will not stay in the tissue till it is completely healed. So catgut should not be used for hernial repair, no. So probably you can go for non-absorbable or synthetic absorbable, either polyglactin or PGA or nylon. So as per your preference, you can go. And under non-absorbable, if you want to use polypropylene, it is most welcome. The reason is polypropylene will retain tension and it will not adherent to the tissue. So that is the reason in all human, for cosmetic surgery, they will be using polypropylene, Prolene. Prolene can be easily removed, even subcuticular suture, intradermal, yes, it can be removed after healing. So it doesn't stick on, whether it doesn't entangle with the tissues. So that is the advantage with polypropylene. Non-absorbable suture, wherever it is used, it should be definitely removed. If it is used on skin, it has to be removed. So there is no compromise. You cannot leave non-absorbable suture on skin. And most of the time, animal will remove, we have a wrong concept that suturing should be applied too tight so that it will stay. No. If you apply a suture tightly, consider you are doing a castration in a dog. You are doing a skin suturing. If you apply it too tightly, there will be self-mutilation. If it is applied loosely, there won't be self-mutilation. So there is no concept that tightening the suture will retain the suture. No. It should be applied just to cause apposition of tissue. It should not be applied too tight. When you have a significant damage and when you expect a large tension, so only thing is you can go for far near far suture or far near. Anyway it can be applied. Only this is the one type of suture which can take the largest tissue tension. இந்த சூச்சரும் போட்டு பிச்சுக்கிச்சு அப்படின்னா அந்த wound க்ளோஸ் பண்ணவே முடியாது. It has to left heal by second intention. Primary closure, you want to do a suturing, you are expecting lot of tissue tension. Tissue tension counteract பண்ணனும் by your suturing அப்படின்னா the last resort is far near far. இந்த சூச்சர் போட்டும் இந்த பேட்டர்ன் போட்டும் டிஷ்யூ பிச்சுக்குது சூச்சர் பிச்சுக்குது அப்படின்னா that wound has to be left healed by second intention or skin flapping. It cannot be treated with normal technique. So remember that. And if you are doing hernia, any suturing can be done. Simple interrupted, yes, if you can oppose, if the hernial ring defect is very small, definitely with correctly placed simple interrupted suture, yes, it can retain. There is no need to apply the vest over pant. So very simple interrupted technique will take care, animal will heal. And try to learn this modified Miller's knot. So this will save you lot of time. If you are going to do small animal practice, you want to do ligature. So most of the time we do ligature and we will be afraid whether it will stay there, we will do transfixation. So if you learn this modified Miller's knot, you need not bother about anything. So modified Miller's knot cannot get untied. So the moment you tie it, it will never slip. So modified Miller's knot is an effective way both in small as well as in large animal practice. Try to learn this simple technique. When you take a throw, one throw, it becomes square knot. When you take two throws and then when you take the free end, it becomes modified Miller's knot. That's all, very simple. So as I was telling about flail chest, when you don't have anything, with the hypodermic needle and nylon suture, you can do suturing. You can bend 16 gauge needle, pass the suture material through the needle and take a bite and use a hand knotting technique. If you do not have any instrument, do this. This is a very simple technique. Definitely it can help you under emergency circumstances. And when you do skin suturing, after healing, sometimes you will find difficulty to lift the suture and cut it. So we will pull it, just we will cut it. Both the knot will come out, but one part of the suture will be retained into the tissue. It will be causing chronic abscess. So under such circumstances, take a 25 gauge or 24 gauge needle, bend it, pass beneath the suture, lift it like a L. You bend it and pass it between the skin and suture, pull it. So you will have a gap. Then you can cut it with ordinary shaving blade. So to recap, gentle handling and aseptic surgery are the two fundamental concepts, two vital concepts that will improve the surgical outcome. Catgut should not be used for herniography. Silk, definitely it causes acute inflammatory reaction that has to be taken care. Non-absorbable suture, if you are using it on the skin, it has to be removed after healing. So round body needles are used for viscera, and now all the companies are supplying both round body as well as traumatic needle. Traumatic needle in all shape they are supplying. So ready-made it is available. You can purchase and you can make use of it. And digital literacy is indispensable. You are living in 2024. You are not living in 1974. So digital literacy should be known by every veterinarian. You have to know how to use the gadget. So you need essentials. It can be a surgical essential, it can be a medical essential, anything for a successful practice. And most of the time, we find difficulty in making the resources available. So remember, all essential items which are required for field practice is ready-madely it is available. Amazon, Flipkart. You want to go for a Dynaplast. Yes, it is available, 178 rupees. The moment you order it, next day it is going to be available at your doorstep, at your dispensary. So you can make use of it. Microport, transport. Transport is going to be, definitely it is going to be far superior. Only thing is, it is going to be little costly. But quality product is available, and the moment you put a order, next day it is going to be at your hand. So there is no point in saying that it is not available. It is available with your mobile. You can make use of it and make things, essentials available before you start the procedure. Yes, POP is available. Fiberglass cast is available. Surgical gloves is available. Examination gloves is available, and it is cheaper than market. So definitely, and it reaches you at your desired place. Even you can change the address to the client home. So it will be, when you reach there, it will be available. So make sure that you try to use. And you cannot say that you do not have a needle holder, you do not have a Mayo scissor, you do not have a thumb force. Yes, the moment you order 600 rupees, 200 per instrument, yes, next day it will be available. You can share the link to the owner and you can ask him to place the order. It will be ready-made. It will be readily available next day when you go to the surgical intervention. So everything is available. Suture is available. So as done, yes, you can select and you can make use of it. And try to have a cheaper material. Badminton, everybody is playing shuttle badminton. Badminton gut, 20 rupees. Have a pack, purchase it, put it in your bag. If there is an emergency circumstance, you definitely will have 16 gauge or 18 gauge needle. You have sealed badminton gut. So wherever you want, even if it is a jugular vein, pass the needle, through the needle, pass the gut, take it, tie it. That's all. Suturing will be completed. Ligature can be definitely done with this material. And persons who are above 45, 40, try to have a magnification. We need not strain. If you want to do a suturing, go for magnification. So whoever is using plus, minus, leave it, they can manage. Whoever is using reading glass or above 45, who cannot take bite, go for magnification. It is available in online e-commerce platform. So go for that. Your suturing will be more refined, fine. That's all. You are going to improve the efficiency. And wherever you want sterilization, see, tumbler heater is available everywhere, 400 rupees. So you can carry anywhere. Immediately you can boil water and you can do whatever intervention. Even if you want to sterilize the suture material, definitely this will be of much use. Coming on to the part 2, common surgical affections. So bovine ocular squamous cell carcinoma is an emerging problem. And it is a very simple problem, and only when it is unattended or delayed presentation cause all sort of complications. At the initial stage, during the start, it will be, growth will be starting at the third eyelid. When you don't treat at that particular stage, you are going to end up with corneal invasion, and the surgical option will be only enucleation. You are going to remove the tie. So timely, appropriate intervention will save the vision. So that has to be remembered. Very simple. If the growth is very small, you need only local anesthetic. Proparacaine for administering local anesthetic, because I can do very gently, because that is my job. So I can take a 25 gauge insulin syringe, I can infiltrate local anesthetic lignocaine into the third eyelid, I can do the surgical intervention. If you are not very comfortable, combine proparacaine, you would try to purchase one vial, 40 rupees. Try to have lignocaine. Apply 2 or 3 drops of proparacaine where you want to inject your needle, so that the animal will be cooperative for the procedure. So administer local anesthetic, you can very easily lift the third eyelid growth. Put a clamp, artery forceps, cut it. Leave the clamp for some time. Automatically there will be hemostasis. Still, if there is a bleeding, probably you may require a simple ligature. 3-0 with the Swaziland needle, one single bite. That's all. You will prevent the entire complication. So this is a very simple technique. Anywhere it can be done. If you do not do that, definitely you are going to end up with neovascularization of cornea, pannus. Once when it starts, that's all. The animal will have vision impairment. Sometimes it may lose its vision. And when you have horn avulsion and fracture, you have to take a decision whether to treat it as such, whether to retain it, or whether to go for amputation at the level of fracture. This depends. There is 2 schools of thought. One says that it can be retained and it can be treated. As per the owner, because this is a bullock, sometimes they will have their own perception that it should have the horn. So under such circumstances, go for corneal nerve block, go for chemical restraint, examine whether it will not cause complication if you retain the horn core. And if you come to a conclusion that no, it will go for sinusitis, go for amputation. So that depends on the circumstance where you are working and based on the owner's demand. And young animal getting horn cancer is now it is increasing. So at the start, if you are diagnosing and if you have a confirmative diagnosis, go for amputation. That's all. Squamous cell carcinoma confirmed. So there is no point in retaining and treating with the copper sulfate. It has to be amputated. Horn avulsion, always go for bandaging, including the normal horn. Don't do bandaging only on the affected horn. Try to take an anchor from the normal horn and go in the fashion of figure of 8. This is a very simple technique. Corneal nerve block, 5 to 10 ml, definitely all animal will get desensitized. Definitely your intervention will be comfortable. Base of the horn, lateral canthus of eye. Midway, you will find the frontal crest. So definitely, if you inject, you are going to achieve complete desensitization of horn. Your examination as well as intervention is going to be more effective. Auriculopalpebral, just below that, if you deposit or increase it to 15 ml, automatically when you do massaging, it will block the auriculopalpebral nerve. 4 point, yes. And coming on to the umbilical affection. So most of us know umbilical hernia, umbilical abscess. So this is a peculiar case when you have a covering similar to a cord. Don't imagine that it is inflamed cord. It has to be examined thoroughly. Even this is my own case, I have attended. I also had a doubt and I thought of putting a ligature. When it was subjected for both Doppler as well as radiography, we could see that it was having intestine. So probably without these diagnostic technique, if I would have done something, simple ligature, animal would have been lost. I would have lost that particular case. So this is an emerging new case. So when you encounter such cases, do a detailed examination or do a extra examination similarly. So you can find intestine herniating. This is a congenital evacuation, very rare, but still we are getting cases. And when you have a swelling, most of the time, the moment you see a swelling, you jump into a conclusion that it is a hernia. No, it can be a hernia, but make sure that it is not seroma, or it is not an abscess, or it is not an fluid-filled cavity. So when you palpate it, typical fluid-filled feel, if you can encounter, if you can feel, go for exploratory puncture. And if you can draw fluid, open it, lance it. And definitely you will have fibrinous deposit, even muscle. So always you have to remove that and then pack the cavity with ceton. So that is the only way you can treat. There is no other shortcut. So this is a very simple case. Do a palpation, you are feeling fluid filled feel. Go for exploratory puncture, open it, that's all. Hernia, definitely you can reduce the content, you can palpate the hernial ring. So this is different from that. So don't jump into a conclusion. If there is a swelling on the lateral abdomen, it should be always hernia. No, it can be a seroma or it can be an abscess. So when you do a teat intervention, always remember chemical restraint is important. Imagine this is a buffalo. The moment you touch the buffalo teat, either it will be lifting its hind limb or it will be urinating. Imagine if this particular animal has to be treated for apical teat obstruction. The moment every time you touch, it will be contaminating the site. Whatever be the sterility of the instrument, it is going to end up with mastitis. So do a chemical restraint the animal properly and do it. It never lifted its leg. It was totally immobile. So go with that technique. So which I will be discussing little later. And if you want to do a suturing or surgical intervention, always go for ring block. At the base, you inject local anesthetic. Make sure that you use 24 gauge needle or 25 gauge needle so that you don't cause hemorrhage from the teat because of your intervention, iatrogenic. So teat affection, if you want to do a surgical intervention, chemical restraint is must. Asepsis, definitely, otherwise it is going to end up with mastitis. So adequate analgesia, only then animal will be cooperative, because teat is a very sensitive tissue. Without analgesia you cannot do intervention. Appropriate surgical protocol. If you want to do a two-layer closure, yes, go for two-layer closure. If you want to do single layer, decide based on the case. If you want to do two-layer, yes, it has to be done only with two-layer closure. Post-operative care is very, very important. Bandaging, very simple technique is put a condom, that's all. Condom is the cheapest post-operative care for a teat. So never it will get contaminated. So that can be done practically. Wound management, definitely there are very basic principles which most of the time we neglect. So cleaning, use large volumes of water. Clean the gross contamination, that is most important. And infection control. Now I was discussing with Albert. So osteomyelitis, he was expecting. So whatever antiseptic we have will become inactive in the presence of organic matter, or it will have only a short period of activity. Whatever be the antiseptic, iodine preparation, chlorhexidine, whatever be the preparation. The only antiseptic which has persistent antiseptic property is iodoform. Again, iodoform is available online. So purchase it. Iodoform is the only antiseptic which has persistent antiseptic property even in the presence of organic matter. So when you expect osteomyelitis or when you expect a chronic infection, change the antiseptic. Not the, he was telling he has used almost 7 antibiotics. There is no point in changing the antibiotics. See, all antibiotics will not be reaching. So, in the local condition, you have to take care of the organism. So, that can be very easily tackled with antiseptic. So, go for that. Don't invest on antibiotics, costly antibiotics. So potassium permanganate is the cheapest material. Try to use 0.1% for lavaging. 0.1%. That means 0.1 gram in 100 ml. 1 gram in 1 liter. 5 gram packet is available. open a 5 gram packet, put it in a 5 liter bucket, small bucket. So you will have 0.1% solution. Use lavishly, clean the wound, and potassium permanganate always try to have a stock in your bag, kit. The reason is when there is an unexpected bleeding, potassium permanganate can be used as an emergency medicine. You can put potassium permanganate crystal over the hemorrhage and you can hold it. It will cauterize the tissue. Remember, it is an exothermic reaction. It will be producing heat. So make sure that put a gloves and put a gauze piece and then try to pack it. So always try to have a potassium permanganate crystal in your kit to manage emergency hemorrhage, bleeding. Imagine this case was presented. When I asked, he was telling, septic aiduna. See, it is a gross contamination. It is having a pus discharge. Yes, sir. Any doubt? No. There probably you can go for benzyne. So this is where you cannot control. It is having a systemic bleeding disorder and you are unable to control. Under such circumstances, you can completely cauterize. Tumor, horn avulsion, because of tumor, there is a profuse bleeding. You are not finding one single point. It is coming from all points. Under such circumstances, yes, it can be used. So this is a common misconception. So try to use adequate water and clean it thoroughly. When you suspect a swelling, abscess, do one exploratory puncture. Confirm it. Yes, it is an abscess. Open it. That's all. Don't hesitate to open an abscess. You need just a shaving blade. You need a syringe and a needle. Explore it. If it is an abscess, immediately, because abscess is going to be a painful condition for the animal. So the more you delay, the more the animal is going to suffer. So open it, treat it as an open wound. Coming on to the third part, pain management. Ripening. That is the, see, when you do exploratory puncture, you will know if there is with pus, open it. If it is a seroma or if it is mixed, probably you can wait. But it is, you know pretty well that it is going to discharge only purulent material. Open it, drain it. That's all. So the third part is pain management. So pain is an unpleasant sensory as well as emotional experience. Animals do have emotion. So pain is an unpleasant. It is not desired. So it is an unpleasant. So it is our duty to remove that unpleasant emotional experience of the animal. So that is the prime objective of an veterinarian. And pain recognition is definitely a challenging task. So most of the animal, they try to hide the signs of pain. So when you encounter a case and you suspect pain, we try to look for the signs of pain. No. Look for the absence of normal behavior. If the animal is not responding, if the animal is not taking food, if the animal is not properly lying down, all these absence of normal behavior indicates that the pain is, the animal is in pain or in a state of stress. That's all. It can be pain or it can be in a state of stress. So recognition, definitely it is difficult because animals consider humans as predators. So by evolution, they don't show signs of pain to a predator, and humans are considered as predators. So most of the time you may not agree. See, tiger is the apex predator. ஒரு புலி ஒரு காட்டில் இருக்குது. நீங்கள் ஒரு காரில் போகிறீங்க, முதுமலை போகிறீங்க, ஒரு புலி வருது. நீங்கள் காரை நிறுத்திட்டு இறங்கின உடனே புலி வந்து மனுஷனை அடிச்சிடலாம், நம்மளை ஈஸியாக அடிச்சிடலாம். நம்மளை பார்த்த உடனே ஏன் புலி ஓடிடணும்? ஒரு 100 புலியை பார்க்குறீங்க, 100 தடவை எக்ஸ்பீரியன்ஸ் பண்ணிங்கன்னா 100 தடவை 99 தடவை புலி ஓடிடும். நம்மளுடைய பார்வையிலேருந்து அது எஸ்கேப் ஆகிறது தானே பார்க்குது. So it is an apex predator. But they consider humans as predators. ஒரு கார்னிவோர அப்படி இருக்கும்போது definitely ஒரு herbivore definitely they will not show signs of pain to a human. So remember that and try to look for the absence of normal behavior. And this is very, very important. Most of the husbandry practices which are meant to improve the productivity cause lot of pain. And we never employ analgesia for all these procedures. Castration, tail docking, anything, whatever be the procedure. So we never do analgesia. So at least infiltrate local anesthetic into the cord before you do castration. Administer at least meloxicam before surgery so that animal does not feel pain in the post-operative period. So these are all the very basic things. So these are all very easily it can be adapted, and only thing is we need to change the mindset. And we have a misconception that animals feel less pain than humans. No, animals also feel pain similar to humans. They have well developed nervous system. So definitely, and most of the time we think that administering an analgesic will mask the signs of clinical deterioration. Clinical deterioration, wound infection. The sign is, classical sign is discharge. If the wound is contaminated, if the wound is infected, if there is an infection, the wound will be moist. Wound will have discharge. Wound will have purulent discharge. That's all. That is a clinical sign that has to be correlated. Don't look for signs of pain to assess the clinical progress or improvement. And always employ analgesia. And when you talk about pain management, we leave the patient-centered concept is neglected. Whatever is available, we will give. If it is a fracture, we will give meloxicam. If it is abdominal pain, we will give meloxicam or flunixin. Only two drugs, either meloxicam or flunixin. Imagine we concentrate only on the safety. That means whatever I give, it should not cause any problem to the animal. We want to play very safely. We never consider the patient side. So analgesic treatment, pain management should be patient-centered, and it should be effective agent. For a ortho case, simple meloxicam may not be sufficient, or a pain-induced anxiety cannot be treated with meloxicam. You need to have a effective pain management drug protocol, and always remember equitable. So all animals, all conditions will not require the same dose. Each will require different dose. 10 milligram per kg. In some animal it will be effective. In some animal you may require 15 milligram per ml. So this is a very fundamental concept. Understand the concept of equitable drug administration or analgesic administration. Sometimes the animal may require, young animals definitely xylazine, it may not respond. Dogs, it require a little higher dosage. So that has to be understood. So if you are presented with an animal with pain, you will give meloxicam, flunixin or carprofen. That's all. I don't think anybody goes beyond that. Local anesthetic, lignocaine, proparacaine is available. If there is a corneal pain, probably you have to think of proparacaine. With the non-steroidal anti-meloxicam, no, it is not going to be effective. Okay, ulta, intraocular pain, topical analgesic, it is not going to be effective. You have to understand. So, intraocular pain cannot be treated with topical analgesic. There you require systemic analgesic. For cornea, the systemic analgesic is not going to serve the purpose. Understand that. And xylazine, dexmedetomidine, definitely it is going to cause analgesia, but it is going to cause sedation. So we are little reluctant. We are not going to touch. We will not touch. But this can be used for pain management. Then opioids, tramadol, butorphanol, buprenorphine, it is available. Definitely, if it is required, warranted, go for that. And in extreme cases, you need to anesthetize. You need to do a ketamine stun just for intervention. Colic case, hours presented, unable to restrain the animal. You have to stun it with ketamine, make the animal to recommend, administer fluid. For administering fluid, sometimes we use. So these are all the categories, and we stick on only with non-steroidal anti-inflammatory for the simple reason that we consider that as safe. So this is a typical case. This dog met with an train accident, both forelimbs got amputated. So veterinarian referred. So it was struggling, and painkiller we have given. This was rescued by an animal activist. So that veterinarian told very conveniently, very safely that it was given painkiller. What painkiller? When I inquired, he told Malaxi. How it is going to be effective for a dog which sustained a train accident with both the forelimbs getting amputated? It is not at all going to serve the purpose. It needs a sedation. It has to be, it is being referred. So, and the client is an animal activist. He is more concerned about ethical treatment of animal. And in such cases, if you are giving meloxicam, animal will not get sedated. Probably xylazine butorphanol. Animal would have slept comfortably, it would have reached. So this is what is being expected from the veterinarian. So remember, so in this case, administering meloxicam is not patient-centered. It is only veterinarian-centered. He considered animal activist, we should not touch anything, animal should not die. Nothing. If the animal is going to die, this animal I euthanized at Varathanad. Satishar must be knowing. So he is the notorious animal activist, supposed to be. It was from Pattukotte. Nobody was able to convince. I told, with both the forelimbs got amputated, with the spinal fracture, how you are going to maintain? Who is going to take care of that pain of that particular animal? Probably you may have a difference of opinion. But I euthanized. I got written consent from the so-called animal activist. Yes, you have to convince, you have to tell them, and scientifically if you tell, definitely it can be done. So whether meloxicam was patient-centered? No. It was safe. Whether it was efficient? No. Whether it was timely? No. Because it takes longer time for onset of effect. It takes minimum 30 to 45 minutes. By 30 to 45 minutes, animal reach the hospital. No, it is not going to be timely. Whether it is equitable? No, not at all. So remember this concept and try to select the pain management protocol based on the individual need, and it should be based on ethical and evidence-based decision. Don't carry it by the mouth of words. Meloxicam kudutha seriyaidum. Flunixin kudutha seriyaidum. How? No. You should have a evidence-based publication. You cannot say that I have used in 100 cases. All 100 cases would have suffered pain, which we might have overlooked. So always it should be based on ethical as well as evidence-based decision, pain management protocol. Imagine this animal, Jallikattu bull, sustained osseous injury. It was referred. It doesn't require meloxicam, it requires sedation to avoid further complication. It was a closed fracture when it was presented. But when it was transported, it was struggling continuously, keeping on kicking, and the closed fracture has become open. So the mistake is administering meloxicam and not administering xylazine or not sedating. So that is the mistake. So always remember, it should be patient-centered, patient-based. So meloxicam, flunixin. So these two are routinely used. Carprofen, phenylbutazone, ketoprofen, tolfenamic acid. Tolfenamic acid, yes, now it has become a fancy. Probably once a day dosing, so that is why. But I don't think it is very effective. Phenylbutazone, remember that it need a priming dose. So on the first day, it should be on the little higher side. So commonly used lignocaine. So there are 3 preparations for lignocaine. One is lignocaine with adrenaline. One is lignocaine with methyl paraben. The other one is 4% lignocaine topical. So lignocaine containing adrenaline should not be used for epidural use. All the supply, whatever we have with adrenaline, should not be used for epidural use. It is only meant for infiltration purpose. 4% is meant only for topical. You are not supposed to use 4% for infiltration. So I have encountered a toxicity, lignocaine toxicity, when I was teaching the students. So I wanted to deliberately teach them lignocaine toxicity by overdosing. It was intentional. It was a academic assignment. So thinking that it was 2%, by mistake the student have given 4%. So 4% lignocaine infiltration, immediately the animal will show signs of toxicity, will become recommend. Luckily we could save that animal. It was a mistake. So blue color is 2%, black is 4%, red is with adrenaline. Red should not be used for epidural, no spinal. Blue, yes, it can be used for epidural infiltration. 4% is meant only for topical use. It should not be used for infiltration. Okay. 2% again it is preservative, with preservative free. Preservative free should be used for intravenous use. With preservative should not be used for intravenous use. And you have one more preparation, 10% dental or 15%. This can be used for cat, mainly for laryngeal desensitization. You can make use of it. Remember, each puff will deliver 0.1 ml. That means the moment you press it, it will be delivering 0.1 ml of 10%. That means each spray will deliver 10 milligram. Cat is susceptible for lignocaine. So you cannot spray lignocaine with 10% like a scent bottle. 5 spray, that's all, cat will die. So only one spray, 10 milligram, that's all. With that, you have to wait and do the intubation. Anavin is bupivacaine. Advantage is it is more sensory than motor blockade. Wherever you want only pain management, go for bupivacaine. So these are all the cautions. Proparacaine, lignocaine. Proparacaine is indicated for corneal desensitization. Lignocaine is indicated for conjunctiva. Cornea means proparacaine. And if it is a infected wound, your local anesthetic is not going to be effective. Remember that. And now it is available very cheap. Anavin heavy, bupivacaine heavy, 40 rupees. So it is coming in ampule. The advantage is, consider you are presented with a prolapse case. You want to reduce, you want to put a suture, and you want the animal to walk away. You don't want the animal to be recommended. So go for bupivacaine, because bupivacaine will have preferential sensory blockade. Intervention will be easy, but animal can walk back. Whereas lignocaine, it is not so. Lignocaine, the moment you give, animal will become recommended. So that is one advantage with bupivacaine. And bupivacaine heavy is again more preferential for sensory blockade. Dose is 1 ml for 100 kg. Roughly you can make it as 1 ml for 100 kg. Lignocaine the same. Epidural, for epidural. No. But consider it if it is a case of, no, anywhere it can be used. Splash block is there. Indications are, I am telling, the case, commonly presented case is prolapse. So where you can make use of this. So remember, proparacaine is indicated for corneal interventions. Intraoperative nociception can be effectively mitigated with local anesthetic, because you will not find the signs of pain. Definitely you can make use of this. Local anesthetic have long duration of analgesic, analgesia, differential functional blockade. That means sensory blockade is desired. You don't require motor blockade. Animal has to walk back. So definitely you can achieve with the use of bupivacaine. And coming on to opiates, you have only 3 drugs commonly available. So butorphanol, can be very conveniently used in large animal practice. We are not using buprenorphine because sometimes it causes opioid-induced excitement. So butorphanol can be very safely used, 1 ml for 100 kg, very comfortable. It can be combined with any drug. It can be combined with xylazine, it can be combined with ketamine. Definitely you make the procedure more aesthetic. So pain versus nociception. Pain you can describe, you can observe signs. Whereas nociception is during surgery, during anesthesia. You will not have visible signs of pain. So nociception can be mitigated by employing local anesthetic. Always administer pain drug, painkillers before the intervention. At least 30 minutes before the intervention you give. So preemptive is one concept. Second is multimodal. Combine very many drugs at lower dosage. You will not have any side effect. So preemptive, multimodal, if you do, definitely your protocol is going to be more effective, more aesthetic. So part 4 is practical tips and tailored solution. I will go just little fast. So dose calculation, definitely you need body weight. Don't rely on the tape and all. Sometimes it gives you a erroneous result. So try to assess. Veterinarian assessment is more than, most of the time it goes plus or minus 10 kg. So try to have a assessment. If you can do measurement, yes. Otherwise, have a thorough examination and have a rough estimate. 10 to 20, nothing happens. Definitely all drugs has a safety margin of 0.5 to 1 milligram for xylazine. Definitely in equines. In cattle, yes, 0.05 to 0.1. 50% allowance is there. Definitely you can manage. So dose you select based on the requirement. Total quantity multiply concentration. Always check the concentration, because veterinary preparation, whatever the companies are releasing, will have different concentration. Atropine, for simple example. Atropine, all human preparation will have 0.6. Dispensary supply will have 1 milligram per ml. Our atropine weight is 1 milligram per ml. So always check for the concentration, because concentration will influence the volume to be administered. And if it is a 300 kg cattle, you require only 0.75 to 1.5 ml of xylazine. If you take 0.05, probably you require only 0.75 ml of xylazine. Don't say that I have given 0.75 ml of dispensary supply and it is not producing adequate sedation. You have to have a standard, well-proven xylazine preparation, because all these anesthetic agent and potent sedatives, you cannot compromise on quality. Try to have your own product, because the volume which you are going to administer is going to be very, very minimum. Anesthetic drug, you have to be extra cautious. You have to make sure that it is of good quality. The quality of the product definitely influences the sedation outcome. Butorphanol, yes, 3 ml for 300 kg. Diazepam ketamine, if you want to make the animal completely unconscious, probably you can combine diazepam and ketamine at that dose, and definitely you will have typical state of anesthesia. If you don't want typical state, probably you can restrict with xylazine butorphanol. If you want to have deeper level of sedation, probably you can increase the dose of xylazine. If you want to increase the dose of xylazine, make sure that the animal is off it. That means food withholding is a must, because sometimes it may end up with ruminal tympany. So 1, 2, 3 is a very simple concept. Mix xylazine, butorphanol, ketamine. 1 ml of xylazine, 2 ml of butorphanol, 3 ml ketamine. Ultimately you will have 6 ml volume. You give 1 ml for 100 to 200 kg. That's all. Intractable jallikattu bulls, any animal, in case of cattle, 1 ml for 100 kg, you can make the animal cooperative for the intervention, definitely. And the dose of xylazine used is very, very minimum. It is within the therapeutic limit. It is very safe. Nothing happens. Even if the animal becomes recurrent, the moment you give a stimuli, it will get up. Whereas with the xylazine, if you go with 0.1 milligram per kg, animal will become recurrent, salivation will be there. Animal will not get up for external stimuli. So the difference is, when you use xylazine butorphanol ketamine combination, even if the animal becomes recurrent, the moment you give a stimuli, it will get up. So that is the advantage. And this will make the animal cooperative for the procedure. It will not produce typical anesthetic state. Animal will be cooperative. So if you want to do a painful intervention, combine it with local anesthetic technique. If you want to do a non-painful intervention, you want to just examine, you want to put a stomach tube, you want to take a X-ray. Yes, with this sedation, definitely you can do. So that is the advantage with xylazine butorphanol ketamine combination. So 1 ml for 100 kg. When you mix it, it will be 6 ml. So economically viable, very safe, nothing happens. So definitely you can make use of this combination for intractable animals. And the dose will be 0.03. So yes. Yeah. This can be very comfortably used in all herbivores because butorphanol ketamine purpose is the logic behind it. The subanesthetic dose of ketamine will potentiate opiate receptor. That's all. The principle behind this combination is subanesthetic dose. That means the animal will not become anesthetized, but it will have profound analgesia. When the animal is not feeling pain, so it will be happy, it will be cooperative for the procedure. That's all. That is the logic behind this combination. You can definitely make use of it. Economically, it is viable. So 1 ml is 20 rupees, whereas 1 ml xylazine is also 20 rupees. So definitely, economically also, it is same. Equines, remember the xylazine dose should be 1 mg per kg. You cannot achieve sedation with underdosing. If you want to have adequate sedation, you need 1 mg per kg of xylazine. Okay, some of you may say, after giving 1 mg per kg, animal is sedated, but it is kicking. Animal horses under xylazine sedation will give a well-directed kick for a non-painful stimuli. Not for a painful stimuli. The moment you go and touch xylazine potu super abdinu tottingana, it will give you a well-directed kick. So remember this. So this is the normal physiological response. It doesn't mean that your protocol is wrong. No. Horses under xylazine sedation will respond for a non-painful stimuli. Poi thatti kuduthinga appadina tottingana odaikum. For a injection, it will not react. For a painful stimuli, it will not react. X-ray எடுக்கணும் கேசட்டை கொண்டு போய் வெச்சிங்க அப்படின்னா ஒன்று கேசட் உடையும் இல்லை பிடிச்சிருக்கோம் ஆள் காலி அவ்வளோதான். So remember this concept. So this alpha-2C stimulation can be abolished or can be minimized by incorporating butorphanol in the protocol. Combine butorphanol with xylazine. Animal will cooperate for the procedure. So this is a very simple. And if you are only dealing with equines, if you want to do a hind limb procedure, go for azithromycin sedation. You have to purchase. Yesterday also there was one query. So 3 veterinarians can combine, purchase 1 vial of 50 ml of azithromycin, have it. It is a potent sedative. So animal will not kick. For hind limb procedure, go for ACP. For forelimb procedure, go for xylazine. That's all. That is the only option. You cannot ask for a shortcut. No shortcut. Radiography in large animal. Don't refer for radiography in large animal, especially femur fracture, hip. No, don't do it. Detailed physical examination are irreplaceable in veterinary practice. Remember, your hands are good. You have to do a detailed physical examination. Nothing beats the power of human touch. If you palpate, definitely you can come to a conclusion. Advanced technology, even digital radiography, cannot match the insights of a physical examination in large animal practice. Always. Always. Sometimes, yes, it gives you information. So I will show you. So you suspect dislocation or femur fracture. Only thing is you need to do a physical examination, flexion, extension, adduction, abduction. That's all. 4. Flexion, extension, adduction, abduction. That will definitely tell you whether the animal is suffering from dislocation or femur fracture. Femur fracture, definitely you can know. Crepitation will be there. Don't refer cases suspected for hip dislocation or femur fracture for radiography. See, you cannot have an image of femur. Cassette can go only up to stifle. How you can put a cassette beneath femur? Have a imagination. So you cannot have a image of femur. Even if the animal is upside down, you can place. But how X-ray will pass through? So remember this concept. So femur fracture or hip dislocation has to be diagnosed only by clinical examination, not by radiography. So this is a very basic mistake most of the time we do. So you cannot, because cassette cannot go beyond that. This is a bull. Imagine you have referred a cow. There will be a udder. How you can put a cassette? It cannot be. So this is a very simple explanation that everyone should carry. The carry-home message is never refer a case for femur fracture or hip dislocation for radiography. So this case was referred. I told you cannot take. It is only with, I had a difference of opinion with the referring veterinarian. Then I sent the image. So you cannot take. Tibia to some extent, yes. Below stifle, yes, definitely it can be taken. But not for hip dislocation. Right. It doesn't mean that you don't require radiography. For a diaphragmatic hernia, definitely you can have a concrete evidence. So this is a herniated reticulum, contrast radiography. I have applied barium, I have taken X-ray. So this is a confirmative diagnosis. Yes, foolproof method. But where to apply, when to apply, that differs. So to conclude, pain management should be the top priority in veterinary interventions. There is a changing moral as well as ethical concern towards animal welfare. So pain management should be the top priority. Gentle handling should be emphasized. Aseptic preparation, aseptic practice should be given the topmost priority. Effective sedation and anesthesia. Definitely it improves your quality of care that is being provided to the animal. And analgesic administration must be tailored to each individual need. Each individual's need, because it differs. Age, condition, trauma, there are so many factors. So analgesic administration has to be tailored for that particular individual, for that particular condition, for that particular circumstance. So push yourself. You have to change, because no one else is going to do it for you. So dream it, believe it, build it. That's all. So thank you, and always expect the unexpected. So with hind limb, no hind limb, animal can walk. Don't give you a prognosis. I was supposed to put a other slide. I could not open it. So it was a pelvis fracture, and we told the prognosis that the kid will not walk, and it adjusted and it was walking. So thank you.